everyone, Dr. Melanie Crites here with 360 Pelvic Health Institute, coming to you from Portland, Oregon with another segment. And as promised, I want to talk about something that is a very hot topic, apparently, recurrent urinary tract infections. And I want to talk to you specifically about the testing for urinary tract infections. Typically, when you go to your doctor and you think you have a urinary tract infection, a urine sample is collected and it's sent off for a culture that takes approximately 48 hours for testing. It picks up bacteria like E. coli and Klebsiella and Proteus and Enterococcus, some of the very common bacteria that we see with urinary tract infections. However, there are those atypical bacteria like ureaplasma that a traditional culture doesn't pick up. And as a result, there have been a number of different companies that have come out with what we like to call an extended urine culture. And basically, through a process called polymerase chain reaction, they can test for this extended spectrum of bacteria. So basically what this means is your urine gets tested for many, many different bacteria, whereas a urine culture traditionally sent to the hospital only checks really for a few different types of bacteria. So these more extended studies can help identify bacteria not only in high levels of presence, but in smaller levels of presence. And it helps your doctor and you to determine whether or not you're having urinary tract infections because there's a low-grade bacteria that's causing a problem, or if you have one of those atypical bacteria. Also, these tests are starting to look at testing for urinary viruses as well, which viruses, as we know, are not treated with antibiotics. That's an entirely different type of treatment. So with these newer tests coming out, your doctor has more of a chance of testing for an extended spectrum of bacteria to more completely treat you. So having said that, ask your doctor. Find a doctor that does this extended testing or has access to this extended testing. Perhaps this would help you. Now, I will caution you, too much of a good thing isn't always great. So when you do these tests, I wouldn't recommend continually doing these tests one right after the other, because the urinary tract does have its own microbiome, so we all have to live with bacteria. And when I say too much of a good thing might not be a good thing, because when we start testing for all of these different bacteria, it can create anxiety in our minds, which is very unnecessary, because we all have to have a certain amount of bacteria, and our urinary system has to have a certain amount of bacteria to be healthy. All these tests are for is to determine if you have that healthy amount of bacteria or if something's causing a problem. So as always, thanks for sending in your questions. I hope this helps, and thanks for letting 360 Pelvic Health help restore your confidence.